Have you been feeling weak, fatigued, experiencing vision problems, or facing dizziness and difficulty breathing? Be cautious. You might be dealing with a vitamin B12 deficiency. Unfortunately, this deficiency is a common cause of fatigue and weakness in adults, particularly in the elderly population. The difficulty lies in the natural absorption of vitamin B12 through the intestines. Vitamin B12 doesn't naturally exist in the human body. It is supplied through animal-based foods and some plant-based sources. However, if your body has lost the ability to absorb it, or if you follow a strict vegan diet, you may likely have a deficiency in this essential vitamin. To determine if you or a family member is experiencing a vitamin B12 deficiency, pay attention to associated health symptoms. But before delving deeper, don't forget to subscribe to our channel and enable notifications to stay updated on our content. Vitamin B12, also known as cobalamin, is one of the most crucial vitamins for the body. It serves as a source of energy, vitality, and is essential for genetic and blood composition. This vitamin plays a vital role in the production and maintenance of red blood cells, responsible for transporting oxygen to various organs. Additionally, when combined with folic acid, vitamin B12 synthesizes DNA and RNA and contributes to the production of white blood cells. Fortunately, the daily requirements for vitamin B12 can be easily met with a balanced diet, requiring only 2 micrograms per day in adults. However, vitamin B12 deficiency remains a common issue. Studies show that incidence rates range from 5% in young patients to 30% in individuals over 60 years old. People with organic disorders that affect the absorption of this vitamin, such as alterations in intestinal microbiota, may experience difficulties. This microbiota, a collection of microorganisms and bacteria in the stomach, plays a role in food decomposition and other functions. Those who have undergone intestinal surgery or frequently consume antacids are more likely to have altered microbiota, hindering vitamin B12 absorption. Even individuals who consume more than 4 cups of coffee daily or take contraceptive pills may experience reduced absorption. The ways in which vitamin B12 absorption can be compromised are diverse and depend on an individual's health condition, lifestyle, and dietary choices. If you feel constantly tired and sleepy, even after a full night's sleep, a vitamin B12 deficiency could be the culprit. The lack of this vitamin leads to physical exhaustion due to insufficient red blood cell production, affecting oxygen transport to the brain and organs. This deficiency is a common cause of chronic fatigue. Vitamin B12 deficiency can be determined through laboratory tests, but even a slight decrease in blood levels has been shown to cause fatigue, especially in the elderly. Persistent fatigue is often associated with pernicious anemia, an autoimmune condition hindering the production of a protein called intrinsic factor, vital for vitamin B12 absorption. Various factors, including medication use, such as gastric protectors and morphine, can also reduce vitamin B12 absorption. Additionally, vitamin B12 deficiency can alter melatonin levels, the hormone responsible for regulating sleep. Therefore, if you're always sleepy, it could be related to vitamin B12 deficiency. Muscles provide strength and endurance to the body. Vitamin B12 deficiency can lead to muscle weakness, as muscles require oxygen for development and strength. If your body lacks sufficient vitamin B12, you have fewer red blood cells supplying oxygen to your muscles, directly impacting their function. Continuous vitamin B12 deficiency results in various neurological symptoms due to damage to the myelin, the protective covering of peripheral nerves. If you're experiencing physical weakness or a decline in muscle endurance, consult your doctor to explore potential vitamin B12 deficiency or other underlying conditions. Vitamin B12 deficiency can cause visual problems, specifically damage to the optic nerve and obstruction of retinal blood vessels. Proper neurosensory function, facilitated by vitamin B12, is crucial for the brain to interpret received information accurately. Visual impairments are a consequence of this vitamin deficiency, and recent studies suggest that it can lead to ocular neuropathic pain and dry eye syndrome. If you're facing issues like blurry vision, dry eyes, or ocular pain, it's essential to consult a specialist promptly. Inadequate vitamin B12 levels hinder the production of sufficient red blood cells, causing DNA production failure. This leads to megaloblastic anemia, where the generated red blood cells are large and weak, preventing them from entering the bloodstream. The result is a pale or yellowish tint to the skin due to the increased destruction of abnormal red blood cells and elevated bilirubin levels. If you notice a change in your skin color, especially a yellowish tint, it's crucial to see a doctor promptly for assessment and appropriate measures. One of the severe effects of vitamin B12 deficiency on the body is damage to the nervous system, known as demyelination. This can lead to paresthesias, a sensation of pins and needles, primarily in the hands and feet. As the deficiency progresses, loss of sensitivity, an impaired sense of position, and vibration may occur. Myelin, a fatty substance covering nerves, facilitates neural connections. When there's a failure in its development or loss, it creates a sort of cerebral short circuit, disrupting communication between nerves and neurons. This distortion in information processing results in mobility and sensory system alterations and even cognitive impairment. While a pins and needles sensation in the limbs may indicate vitamin B12 deficiency, it's crucial to consult a doctor before considering B12 supplements, as other medical conditions may present similar symptoms. Neural damage can affect an individual's motor skills, potentially extending to gait patterns and coordination. Older individuals with B12 absorption issues may experience demyelination, reducing their motor capabilities. This can manifest as increased vulnerability to falls, loss of balance, or a slightly unsteady walk. Early signs of motor impairment should prompt a visit to a doctor, particularly a neurologist, who specializes in studying brain damage and its consequences on functionality. Not all neurological damage is a result of vitamin B12 deficiency, so a specialist will conduct various tests to provide an accurate diagnosis. As previously mentioned, vitamin B12 deficiency can lead to anemia. If you're experiencing anemia, common symptoms include fatigue, exhaustion, dizziness, and respiratory difficulties. The scarcity of red blood cells carrying oxygen to the brain and vital organs can make even minor daily activities induce dizziness and alter your breathing. Adequate oxygenation is fundamental for good health, as organs cannot function correctly without oxygen. Therefore, a lack of oxygen weakens the body and makes it more vulnerable. However, it's essential to note that vitamin B12 deficiency isn't the sole cause of these symptoms, so consulting with a doctor before initiating any treatment is crucial. The tongue, a combination of muscles and taste buds, is susceptible to alterations due to vitamin B12 deficiency. Glossitis, inflammation of the tongue, can occur, causing pain and loss of taste buds. This inflammation can result in the tongue becoming smooth and changing color, affecting the way you eat or speak. Research from the Department of Dermatology at the Hospital de Sant Joan de Déu in Barcelona, Spain, found that vitamin B12 deficiency was the sole cause associated with glossitis in patients. Notably, these patients did not exhibit signs of anemia or neurological issues. This highlights the diverse effects of vitamin B12 deficiency on individuals. Fortunately, tongue atrophy and inflammation caused by vitamin B12 deficiency improve rapidly with treatment and are entirely reversible. If you observe changes in your tongue or a loss of taste, consult your doctor. Another indicator of a potential vitamin B12 deficiency is mood changes. Studies conducted by the University of Western Australia have revealed that low B12 levels can trigger depression, mood swings, and dementia. This is linked to the theory that elevated homocysteine levels, a chemical in the blood used for protein production, can cause depression when B12 levels drop. Homocysteine levels increase with declining B12 levels, causing damage to brain tissue and affecting how the brain processes information. Consequently, mood swings may occur. Some studies even suggest that mood disorders associated with B12 deficiency, without other underlying causes, can show positive responses to B12 supplementation. However, changes in mood can stem from various factors, including hormonal imbalances and other medical conditions. Therefore, when signs of depression, mood alterations, or psychotic behaviors emerge, consulting a mental health specialist is crucial for an accurate diagnosis and appropriate treatment. These diverse signs may indicate low B12 levels. While some are more direct indicators than others, it's advisable to seek medical evaluation before considering supplementation. While waiting for a diagnosis, improving your diet can be beneficial, as vitamin B12 is not produced by the human body but stored in various organs after ingestion. The most common and effective way to provide your body with B12 is through foods rich in this vitamin, such as poultry, fish, red meat, eggs, and dairy products. In today's market, you can also find B12-enriched foods like bread and plant-based milk. Supplements are available in pharmacies and health food stores, but consulting with a doctor before consumption is essential. A pertinent blood test, such as the homocysteine test, can confirm B12 deficiency and rule out other conditions with similar symptoms. We hope this information has been useful. If you have anything to add, please share it with us in the comments section. Don't forget to like this video and share the link with your family and friends so they can also be aware of the signs that indicate a need for more vitamin B12. If you're new to our channel, subscribe for more informative content. Remember, life is always better when you take care of your health.